Welcome to the Hennepin-University Partnership webinar series. Today's webinar is titled When Rent Costs More Than Money, The Health Effects of Eviction, and is presented by Dr. Nick Graetz. My name is Sophia Lackins, and I'm a graduate assistant with the Hennepin-University Partnership. We are also joined by HUP Director Amy Delahanty. The Hennepin-University Partnership is a strategic partnership between the University of Minnesota and Hennepin County that aims to connect these organizations at points of mutual benefit. We aim to catalyze research partnerships, engage students by providing experiences that enrich learning and build a future workforce, and share expertise, best practices, and knowledge, something we hope we'll do today. Before we get started, just a few Zoom reminders for our audience. Your video, audio, and chat are not enabled. If you need any support from the HUP team, please use the Q&A function. If you'd like to ask a question, you can submit that through the Q&A function. We will monitor for questions throughout and save time at the end to address them. And this webinar will be recorded. A huge thank you to our presenter for sharing his time and research with us, and thank you to all of you for joining us today. Please look for an email from hup@umn.edu with a survey and a link to the recorded webinar video tomorrow. And finally, we're so glad to welcome and introduce the presenter. Dr. Nick Graetz is an Assistant Professor of Sociology at the University of Minnesota. He studies how population health is shaped by the historical and contemporary structure of the housing market. He leads a joint project with the US Census Bureau using linked administrative data to study the American housing crisis with a particular focus on eviction. He also leads several projects related to housing, climate, and insurance as a member of the Climate and Community Project. And now I will turn it over to him for the presentation.
Great, thanks so much. And thanks so much for having me here. I'm really excited to present in the HUP seminar series. I just started this past August at the U. And before that, I was a postdoc at Princeton where I helped facilitate this long-term collaboration between Princeton's Eviction Lab and the US Census Bureau, which I'm going to be mostly talking about today. But I grew up in Winona, Minnesota, so coming back here has been sort of a homecoming for me. And besides the fact that I love Minnesota, another huge draw for this job was learning about the Hennepin-University partnership and really just all the possibilities for collaborating with folks like you guys in different state and local agencies around issues of housing and health. So I've already connected with some folks on this call, and I'm really looking forward to continuing those relationships and also hopefully building the start of some new ones here. And so what I'm going to be talking about today is work that's mostly come out of that data linkage collaboration at the federal level, working mostly with the US Census Bureau. And part of what I've been trying to do over the last few months in chatting with folks at Hennepin and the state is starting to sort of lay the groundwork for thinking about similar projects and collaborations using more local and state data, especially in a context where a lot of the work I'll be presenting here at the federal level is very politically vulnerable right now. So we have sort of some ongoing projects in this space that, will hopefully be able to continue, but we'll see what happens. So I'm going to be talking a lot about the connection between housing and health. And, housing has long been studied as a really key social determinant of health. There's sort of four key pillars in the literature people think about in terms of mechanisms connecting housing conditions and health. We can think about housing instability and affordability, as well as physical quality of housing conditions. And then broadly, what we think of as all of the literature on neighborhood effects and how opportunity is unequally structured across space. So something that drew me to this work is that there's especially in the health literature and the medical literature, there's a lot of studies about the connections between the physical quality of housing and health. So we can think about things like lead paint, different, contaminants, exposures that have to do with the actual building itself. And then increasingly, especially in the last 20 years, there's been a lot of studies about how social mobility is shaped by neighborhood, how labor market opportunities are shaped by neighborhood. But there's actually been relatively less research on the connections between housing instability and health and housing unaffordability and health, which I think is surprising given that those things are really core and central to what we think of as the American housing crisis today. And so a lot of these things are probably not new to folks on this call and are certainly not new to precariously housed folks and low-income tenants who have really been organizing around this space and this connection between housing costs, displacement, and health for a long time. But especially this really ramped up in the context of the pandemic. So we saw a lot of organizing happening around eviction, especially in 2020 and 2021, when COVID-19 infection rates were really high. And so these issues aren't rare things that only affect a few people, but are really central to economic precarity at large today. So housing is the primary cost for families. In 2021, the median renter household making less than 30K a year had just $380 left over each month after paying rent. And then, rising rent prices, increasing cost of housing increasingly put families at risk of displacement. And this can happen through formal channels in housing court, such as through eviction. And each year we know around 2.7 million renter households receive an eviction filing. So in general, I study the relationship between costs and evictions and health because these are central to the current housing crisis. These are really prevalent exposures affecting a lot of Americans. They're also built on top of extreme racial disparities, both in segregation across housing markets, especially in the rental market, as well as exposure to unaffordability. And then these things are also really damaging. We have reason to believe these are really damaging for health, especially through things like cost substitution, where families really prioritize making rent each month, even if that means not paying for a necessary medical procedure or experiencing really acute food insecurity. And so, why is there not more research on connections between rising costs and evictions and health? Um, One reason that I'll get into today is that it's difficult to measure evictions and link them to data both before and after the event of the eviction filing. And then it's also really hard to connect these things to health outcomes that can be measured with a high degree of accuracy. So I know there's folks who work on housing on this call and are really familiar with the eviction process, but I'll just lay this out really quick in a couple slides for folks who, are less involved in the housing side of things. So a typical eviction happening through housing court isn't that straightforward. And today I'm going to really be talking about these kind of evictions, or what we think of as formal evictions. So there's lots of events that result in involuntary displacement that can have really damaging health effects. We know there's a lot of events we might refer to as informal evictions. So the simplest case there would be a landlord pushing you out of your home, either by refusing to offer you a new lease or raising the rent by some huge amount or changing the locks on the doors. There's also a lot of instances of those kind of more informal evictions that can be, spanning from legal to illegal, depending on local tenant protections. So the prevalence of those kind of events are really hard to measure, and we still don't have a lot of data on what happens there. What I am going to be focusing on is what we've done with sort of formal eviction filings that we can see in housing court data. And then just also a little background on the legal process of eviction. Most eviction proceedings happen in a matter of minutes and are almost always ruled in favor of the plaintiff or the landlord. This figure comes from some folks in Dallas related to a project providing free legal representation for tenants, and just showing how much of a difference that makes in outcomes that happen in court. So on the bottom, we can see case outcomes when tenants do not have legal representation, which is typically the case, versus on the top, much more varied outcomes when there is a lawyer present. So just to give a sense of the national state of eviction data, And I think there's, probably folks on this call who know a lot more about the local state of eviction data than I do in terms of the Twin Cities, Hennepin, and Ramsey. I'm going to be talking here about what we've done with this national eviction database, but then hopefully can get into some more local connections at the end in the Q&A. So nationally, there's no federal agency that puts together something like a national eviction database. So there's not sort of systematic collection of eviction records at the local or county level and then pushed up to the states and pushed into some kind of federal agency that, produces statistics. Um, Currently, we don't have any sort of systematic collection in that way. So in 2018, the Eviction Lab was established at Princeton University, and the goal of the lab originally was to produce something resembling a national eviction database. So going back to 2000, trying to say what's been happening with eviction filings across every county in the country, been going up or down. Some counties have a lot more filing activity than others. And this was sort of built in a really patchwork way through bulk requests to county and state courts. Um, Sometimes this is easy, and different counties and states have good digitized electronic systems where they keep track of eviction filings. In a lot of places, it was really hard. And a lot of times involved a lot of manual collection of records and digitizing. And then once all the records are digitized, there's also a lot of data cleaning needed. There's a lot of clearly clerical errors, a lot of duplication of records. We needed to clean and standardize all the address information. And then also just do a lot of validation work comparing what we could collect and aggregate from the record level up to sort of different totals reported by counties and state court systems. So using this national database, the two sort of outcomes or eviction-related indicators that I'm going to be talking about today in this work, connecting eviction and health, is really just, was someone filed against, and did that result in a judgment? And so we kind of think of judgments as typically proxying an eviction actually being carried out, but we know that in reality, that's not always the case. Things are often messier than that. And then a filing without a judgment also doesn't mean that a tenant was able to remain in their home. So a lot of times tenants might leave after receiving a filing, not show up for court. There's all sorts of, messy things that can happen in between here. But, combining this data across counties and states, these are sort of the two indicators we can pull out of the data across time and space that are really comparable. So we can actually be comparing something like a filing rate across every county and state in the US. So this map just gives you a sense of the geographic distribution of filing activity in the United States. So this is the average filing rate estimated from 2000 to 2018 by county, where the more yellow counties have higher filing rates. And so one thing that we've done with these data is sort of just these big aggregate rankings and statistics across time and space in terms of just the basic how much eviction filing is happening. And so we see there's really sharp state boundaries. So state of residence, as I think we expect, matters a lot. And within states, there's also quite a bit of variation across counties. We've done some work relating filing activity to state and local policies, but there's a lot more work to do there. And generally just in trying to explain this hugely unequal distribution of filing activity. So that's kind of the summary of what we know across the United States about eviction. And then what I'm going to be talking about today is how we started filling in some of these gaps of what we don't know. So even after we've established, tried to put together this comparable national database, what do we still not know about eviction dynamics and how they shape health? So one big area that we have very little research about is on the plaintiff side of things. So who owns rental property? How do different financial characteristics of owners and different ownership entity types shape filing activity? We have done some studies at this point, looking at things like how big does the size of the building relate to filing activity? A lot of this work is becoming a lot harder because of the increased proliferation of LLC ownership and LLCs tucked into other LLCs that make it really hard to establish who is the beneficial owner of any given rental property. One thing we do know is that most filing activity is heavily concentrated in specific buildings. So one thing we've been able to establish with the national database is that in many cities, 10% of buildings account for over half of eviction filings. I'm going to skip this and just get into what I'm doing here with this linked eviction work. So the other two big things we don't know about eviction is defendant characteristics, and that's because eviction filings typically are just including names and addresses. So we don't have any even basic information about demographics, age, race, sex are not recorded in court records. There's definitely been a lot of work, especially at the local level, to try to get a handle on this. Different sorts of small scale survey data, different sorts of observation in housing court, different sort of work trying to impute things like race and gender from names and addresses. But this tends to be sort of small scale in this kind of patchwork framing. And then we have very little data about defendant outcomes post-filing. So again, it's sort of tricky to follow people after they come through housing court. There's been some small scale survey efforts to try to get a grip on this, but we don't have any sort of big comprehensive comparable effort. So these two bolded here are the work that I'm going to talk about today, especially thinking about health-related outcomes post-filing. So again, just to summarize the data we're working with here, in the papers I'll present here, these are based on 2000 to 2016 court records representing about 58 million individual defendants across the country. But each court record really just has names and addresses. So the tricky part becomes how do we link those things to other data sources that let us get a grip on both who's affected by eviction, who is showing up in these court filings, as well as linking those individuals then to outcomes following eviction. So I'm going to go through this linkage process fairly quickly. I could spend the whole time talking about exactly how this happens, and happy to get into it more in the Q&A, or if folks want to, have a separate conversation about data linkage. I'm really interested in learning more about what's possible, what's going on at Hennepin and also in the state of Minnesota. But we basically, at a high level, we work with a team called the PBS team at the US Census Bureau, who has built a probabilistic data linkage infrastructure to basically represent every federal source of either survey or census data. And so the crux of this system is that they have longitudinal unique identifiers that are basically function as social security numbers that they've attached to individuals in every federal data set that the US Census Bureau has permission to use. So things like the decennial census, the American Community Survey. And so if we can assign those individual identifiers to people showing up in eviction filings, it's then easy to merge them to any other source of data that the US Census Bureau keeps track of. And so that's generally our strategy here for this project. I sort of have here in this bulleted list all these different modules that the PBS team uses to try to identify individuals. And so sometimes this is really easy. Like they're working with a lot of data sets that have social security numbers and dates of birth. But other times it's much harder. So in our case, it represents one of the more difficult cases the PBS team works with because we only have names and addresses. So we don't expect this to be close to a complete match, especially given this is a population that's moving fairly often and might not have a complete address history. But the benefit of the federal data system for linkage is that they have access to IRS tax returns, postal service data, social security data, um, where they're essentially able to cross-reference names, addresses at the neighborhood level with every address they've ever, seen somebody report at across all these systems. So again, we're really relying on these different modules they use for names and addresses. And through these modules, we've been able to successfully link about 65% of individuals. And again, what I mean by linkage here is to these unique identifiers. So for about 65% of individuals who show up on a court filing, the Census Bureau is fairly sure they know who that individual is. And so once we have those identifiers, we can then link to other data sources. And so in the work I'll be presenting here in the next slide, these sources highlighted in red are the ones that we focus on. So we've linked individuals to Social Security data, which gives us date of birth and date of death if an individual has passed, as well as decennial census responses and American Community Survey responses. So those give us race, sex, full household rosters. And so I'll be using those to describe who is affected by eviction, who shows up on eviction filings. And then I'll also be using date of death from Social Security to show how eviction shapes the risk of mortality for renters. So getting into results here, this figure shows the population in millions affected by eviction filings every year. And so if we look over on the left, what we're able to do here is actually differentiate who's directly listed on an eviction filing versus who else lives in that household. And so on the bar on the left, we can see about 7.6 million individual renters every year are affected by an eviction filing. And what I mean by that is if we look in the second bar on the right, we have close to 3.5 million individuals directly listed on the filing. And so that's less than half of the number I'm describing on the left, which includes everyone else living in that household. And so those folks are living in that household, are affected by that eviction filing, but aren't actually listed on it. And so who does that include? That includes unlisted adults. So these might be other adults living in the household who are not on the filing for whatever reason. It's hard to know exactly why, because there's not sort of any check or validation usually that's happening in court. These are likely adults who are not on the lease. So we typically think that who shows up on the eviction filing is usually going to be who's on the lease, and a lot of folks live in share households who are not necessarily on the lease together. And then the other really big population included here who virtually never shows up on court filings is children. So about a third of these folks affected every year by eviction who are sort of invisibilized in court filings are the kids of those filed against. And so who are these other unlisted adults who are affected by eviction but not on the filing? A lot of these are the adult children of those renters filed against who are, still living at home. Folks are generally age 18 to 22. A lot of it are spouses who might not be listed on the lease. And then a smaller group are sort of non-relatives or other people living in the household not related to the individual filed against. This figure shows the age distribution of folks affected by eviction, which again, we haven't really ever been able to see because age doesn't get reported in housing court records. But we can see it here because we've linked all these individuals to dates of birth. And so we can see that in the black line represents the age distribution of the renter population. So we know that the renter population is younger than the US population overall. And the orange bars represent the age distribution of the population filed against in housing court. And so we see this is disproportionately children affected. and mostly adults age 20 to about 35 or 40. If folks want to sort of get more into the context and the weeds on eviction and young children, the New York Times did a good write-up of this study with a lot of great interviews with folks working in different services along this pipeline. And then I also just want to note that while eviction risk kind of drops off over age, it does so pretty slowly. So there's a lot of older renters who are still affected by eviction. And this is really different than sort of other court system exposure that we see in the research literature. So, for example, there's a ton of literature on exposure to criminal court systems where we see these huge drop-offs over age. We see that to some degree with exposure to housing court, but the drop-off is much, much slower. The other thing we see in this data are really massive disparities across race and the presence of children in the household. So this figure shows eviction rates for the top panel is households with children, and the bottom panel is households without children. And then here I'm looking at by white and black renters and men and women. So in general, we find that eviction rates are about twice as high if there's a kid in the household. And within these groups, there's also just massive racial disparities. So filing activity is really concentrated among Black women, especially those who are living with children. I can get it more into the data, the way we set up these cohorts for estimating how eviction shapes mortality risk over the lifetime. Maybe in the Q&A if folks are interested, but we generally start with every renter in 2000 in the decennial census. We link them to evictions and dates of death over the next roughly 16 years. And then we look at how we also link them to responses in the American Community Survey. So for a subset of renters, we can see changes in rents over their life. And we can also see changes whether they're filed against or not, and ultimately how both those things are related to risk of death. So this figure shows the association between rent burden in 2000, sort of when we start following individuals, and the hazard ratio for all-cause mortality over the next 16 years. And so we see that paying 50% of your income on rent versus 30% is associated with about 9% higher mortality. And for 70 versus 30% housing cost burden, about 12% higher mortality over the period that we study. We also look here at individuals, like I mentioned, who we can see in both the 2000 census as well as the ACS in any of the about 10 years later. And so here I'm looking at individuals who experienced a change in rent over those 10 years and how within those individuals that shapes mortality risk. So for individuals who saw a 10-point increase in their rent burden over that period, they then saw about an 8% increase in mortality over the next 10 years. And for folks who saw 20-point increases of about 16%. And so 20-point increase in rent burden might sound like kind of an outlier, but we see this as a really common experience among renters in our data. So especially for renters through midlife, the experience of going from paying 40% of your income to 60% over this period was really high. It happens to about 40% of renters. Something we're also able to do here, because we have folks linked to the master address file, is we can establish a set of renters who we know are living in the exact same address over this whole period. And the only thing that's changed about them is that their rent has increased. And so we can think about this non-mover group. We also are linking to incomes, so we can see folks whose incomes have stayed basically the same over that period. And these results hold even in this group of people. So this doesn't seem to be driven by sort of selection into rent increases. Rather, there's a huge chunk of renters that are basically living in the same places. Incomes have been fairly stagnant over the last couple decades, but rents have increased a lot. And this has translated to a pretty substantial increase in mortality risk for this group. And I should also mention, I didn't really get into the survival models we're using for this, um, but this is controlling for tons of differences that we might expect to vary systematically across renters. So all the demographic characteristics we can measure, as well as things like household income. We also find that it being filed against for eviction, even if it doesn't result in a judgment, is associated with about a 20% increase in mortality, and an eviction judgment associated with about a 40% increase. So in mortality work, these are really large changes. And so we see that the point at which you're exposed to housing, an eviction filing in a housing court really seems to be this critical point of possibly experiencing a much higher rate of mortality over the following 10 years. The last eviction-related mortality project I wanted to mention is what those results I just covered basically cover the whole pre-pandemic period back to 2000. We've also done a more targeted study in 2020 and 2021 in locations where we've been able to track with close to 100% accuracy eviction filings over that period. So this includes roughly 33 cities across the US, as well as 6 states. And one of those cities is Minneapolis, St. Paul area. So one thing we've been able to do with those linked data is look at during the pandemic, what did excess mortality look like for the population filed against, and sort of compare that against excess mortality in similar renter populations. So just to review excess mortality, it's this, the idea this was published on a lot in media and research during the pandemic of this idea of because it's very hard to track COVID-related mortality increases, we can instead look at what was the background mortality rate heading into COVID versus what is the mortality rate we saw during COVID, and attribute that difference to increased mortality driven by the COVID-19 pandemic, which might be COVID-related deaths as well as increases or changes in other mortality as a result of changes happening during COVID. So we compare the population of renters filed against to excess mortality in the general population in these cities, as well as the population in high eviction filing, high poverty neighborhoods who weren't filed against. So we treat this sort of comparison group as the neighbors of those folks who are filed against, who we think are probably fairly similar in socioeconomic demographic background characteristics. So first, we have a graph here of excess mortality in the general population during this period we're looking at. And we see that all-cause mortality is about 10% higher, especially during that first period of the really intense pandemic period. And this is generally similar to national statistics reported by the CDC. We then see in our group of folks not filed against, but living in these really high filing, high poverty rate neighborhoods, we see excess mortality about 25% higher. So rather big jump there. And in our population of renters threatened with eviction during this period, we see that mortality rates were about 106% higher than previous to the pandemic. So to summarize, were likely really extreme health-related impacts of being displaced during the pandemic. It was hard to trace this while it was happening. A lot of folks, local groups did a lot of really great work here in this space, but it looks like systematically across the country, being filed against during 2020 and 2021 had really big implications for risk of death. And so that could have been through increasing the likelihood of COVID exposure, through things like doubling up, through things like exposure to being unhoused. So just to summarize sort of what I covered here, and then want to sort of tee up some things that I'd love to chat about in the Q&A. All this work so far at the federal level with the US Census Bureau and connecting eviction records across the country, we've found that higher rents are associated with higher mortality. Um, we've found that just in terms of who's affected by eviction systematically, we found that the population living in households threatened with eviction is about twice as big as the number of folks we actually see listed on the filing. Filing activity is extremely concentrated in families with children, especially Black women. And then evictions are associated with really high increases in mortality prior to the pandemic, and really massive increases during the pandemic. And so I'm happy to share these slides afterward. Here I just listed out the three published articles that cover this work if folks are interested in getting a little more in the weeds on the data and methods used here. Um, in terms of ongoing projects, uh, everything I mentioned so far is mostly based on linkage with the American Community Survey and decennial census data, as well as all-cause mortality information in the census Numident file. Some of the new projects we're working on, we have a project looking at eviction dynamics among college students, connecting to school records and outcomes data following enrollment. We have some work looking at neighborhood trajectories using the master address file in terms of where people living before they got filed against, where are they living afterward, in the year afterward, 5 years afterward. What are these sort of longer term trajectories of displacement? And then we also have some work with certain states where we've linked to different large state level assistance programs like SNAP and seeing how does eviction shape SNAP enrollment and vice versa. And then the other really big set of projects we're working on is the long-term effects of eviction for children. So this includes some health outcomes, school outcomes, where, part of the takeaway from this work so far is that this is really a massive population who's really affected by eviction. And so to get into some of the Q&A here, I just wanted to put up a few statistics about the Twin Cities area and comparing it to the other cities and states that we track. If folks want to look at this data, we call this the eviction tracking system on our website, where we work with different cities and states to collate and make comparable eviction data so we can do some of this ranking and comparison. The orange bar I've highlighted here in the middle is sort of the average eviction filing activity since 2020 across all the sites that we track. And then the orange bar towards the top with the relatively lower rate is mislabeled here, but is the Hennepin and Ramsey County. So, relatively speaking, eviction filing rates are lower here than in the other sites we track across the country, especially looking at just extremely high levels of filing across some cities in Tennessee, South Carolina. But one thing that's unique about the Twin Cities area is sort of how things have changed over time since the pandemic. So this figure shows filing rates relative to their baseline prior to the pandemic across all the sites that we track. So one here, that dotted line means filing activity is basically the same as it was pre-pandemic. And so we see in early, 2020 going into 2021, when things like the CARES Act were happening, a lot of it, national eviction moratoria, as well as local moratoria, and things like the Emergency Rental Assistance Program, we saw this massive decline in eviction filing rates. But in general, across the country, we find that filing rates have returned to their baseline averages. So starting in around 2023, filing activity sort of resumed at the level that we were seeing prior to the pandemic. This orange line that I've overlaid here is filing activity since 2020 in the Twin Cities area. And so one thing that's unique relative to the other cities and states that we track is that filing activity remains about 50% higher than it used to be um, in the Twin Cities. And I think this is sort of a puzzle. We don't have a lot of great explanations for this. I've chatted about this, to some degree with different folks working in Hennepin. Would love to dig into this more and do sort of a deeper dive with the local data and different programs who are really thinking about eviction prevention um, and trying to get a handle on why this is happening. And then the last thing I'll say is that, all the work I've presented here that's sort of happened and ongoing with the US Census Bureau uh, is on one level very, we can get this really broad, comparable picture across the country, but we have to rely on sort of pretty superficial indicators of things like health. So everything I presented here, the only health outcome we have access to is all-cause mortality. It's really hard for us to link to cause of death. We don't really have access to other health-related systems um, or surveys. And so I think while the federal data linkage I'm really invested in, I think there's a lot of good work to still be done there. I am really interested in getting into doing more work with folks here at Hennepin and also across Minnesota, looking at sort of similar data linkage possibilities to study similar things. So what are the causes and consequences of eviction and involuntary displacement? Um, Thinking about possibly expanding the health outcomes available. So possibly linking to things like EHR data. And then also just a lot of really great opportunities for impact evaluation. So at the national level, we're doing some of this. We have a project looking at the emergency rental assistance program across the country, how that shaped eviction or not in different places, depending on differences in implementation. But I think locally, there's so many policies, both housing and non-housing, that I think can have, possibly large consequences for population health through shaping things like how precarious is your housing, how costly is it to you, how likely are you to be displaced. Um, but I think, building the data systems to track some of those things and track outcomes over time is something I'd love to learn more about from the expertise of, everybody on this call. So love to get into this more in the Q&A, and also please, reach out if you'd like to chat about anything, possible connections here based on a lot of the themes that I just talked about. So I think I'll stop there and open it up to get into the Q&A a little bit.
Sweet. Thank you, Dr. Graetz, for an amazing presentation. As a reminder to our audience, please use the Q&A function to ask any questions. And for the Q&A, we are also joined by Will Lehman, who is an area manager in housing stability for Hennepin County. Will, I'm going to promote you to a panelist, so you should have the option to enable your video and mic. Sweet. So our first question here, I think this was happening as you were speaking to this, Dr. Graetz. So maybe you answered it a little bit, but when is the last time you checked the Hennepin County eviction rates? And are those, when you're looking at it, is it combined Hennepin and Ramsey, or are you looking specifically at Hennepin County?
Yeah, so it's combined, and we update them on the website every 2 weeks. So I think the figure I showed is a little out of date, but things have been, it looks like fairly steady over 2024 and into 2025.
Great. And while we're waiting for questions to come in, Will, if there's anything you want to say or things you noticed about the presentation that you'd like to add some Hennepin County context to.
Hey, good afternoon, everyone. Will Lehman with Hennepin County. I work within our housing stability area in our human services department and support a team that works a lot on eviction prevention as one of our hallmark sort of homelessness prevention strategies. Just find the entire body of research really compelling. was taking a lot of pictures. I think, yeah, what stands out to me is that it's clear that housing stability is not just a housing issue, it's also a health issue. It's also an issue across a multitude of domains that speak to self-sufficiency, well-being, and safety. So just from a high level, I think that's what stood out to me. Happy to provide some local context as well around our eviction prevention work, if that's helpful to the group. We have a sort of a two-pronged strategy for preventing evictions within Hennepin County. And they're sort of built around two primary observations and historical trends that we've seen in data from housing courts and among tenants at risk for eviction. And one is that historically, tenants have not had access to legal representation as a really pivotal tool for improving the likelihood of a positive outcome through an eviction proceeding. 10% of tenants have had access to legal representation. That's prior to COVID era eviction moratoria. And the county's Adult Representation Services Department has stood up a universal right to legal counsel for all low-income tenants at housing court. It's a really, I think, groundbreaking commitment we've seen in a few other jurisdictions, like New York City stands out, and that has dramatically increased connections to legal representation for those who are most at risk for an adverse outcome at housing court. The second historical trend is that the majority of filings we've seen in Hennepin County cite non-payment of rent as the lease violation. And so this really is an economics issue. I think that's fairly intuitive, but those data really, I think, bear that reality out pretty substantively. And so we've stood up an emergency rental assistance program as well, fairly rapidly, initially during the beginning of COVID, through federal COVID era ERA programs, and then subsequently sustained with some new state resources the last few years. In 2024, we pushed out more than $13 million in emergency rental assistance to help households, preserve their housing and avoid eviction. And that was to more than 3,500 households, which makes up about 40% of households with a filing for non-payment of rent in 2024. So we'd love to increase our coverage, of course. But those are two prominent strategies that we've really made strong commitments around in the last 5 years.
Yeah, thanks for that. The two things I would just add are looking across the country, we see the same thing in terms of non-payment of rent is the vast majority of reason listed on court filings. So I think that's true pretty much everywhere. And I think, as you said, speaks to, the economic issues at play here in terms of housing costs. And then also just want to lift up the amazing work of rolling out the emergency rental assistance program. I mean, I think generally it was a really unprecedented investment in tenants that I think happened during a time of crisis, and the fact that we were able to roll that out. You guys were able to do that here and a lot of places across the country. I think there's still, we're trying to do a lot of evaluation projects of, exactly how huge the impact was of that. But I think just descriptively in the data, like we can see there was clearly such a massive effect of that. So I think, especially as we're scaling back from that, I don't know necessarily exactly what is going on here at Hennepin in terms of that, but in a lot of parts of the country, we're seeing a lot of rollback of emergency assistance programs. I think it's just a really critical time to lean into some of that research and to just show how important those programs were for keeping people stably housed.
Yeah, absolutely agree. And we are facing some budget constraints within the county, within the state, federal level, of course, that are placing some pressure on our ability to sustain. But it has been a concerted commitment for our county to do whatever we can to sustain those investments. And I'd be remiss not to give a shout out to Heidi Schmidt-Boyd, Mikkel Beckman, who's my predecessor, Julie Welly-Ayers. Those are the folks that led the rollout of federal ERA in early COVID. So shout out to them.
Great. So I'm going to jump us into our next question here. What do we know about the other causes of eviction aside from non-payment of rent? When evictions are filed for lease violations, do we know what those violations are specifically?
Yeah, so I mean, I would defer to folks who are really familiar with the filing data here. in Hennepin and Ramsey. I think in general, it really depends on the place we're looking at. So across most of the country, we have very little data on the reason for filing beyond just some really big buckets. And again, like the vast majority of those just say non-payment of rent. I think one thing we do know from really targeted, especially qualitative work in housing court and following tenants over time is that I think we have to be careful separating the cause of eviction into non-payment of rent and other stuff listed, uh, where ultimately what gets put on the filing is non-payment of rent, but the timing at which that happens really varies, and it really depends on when a landlord feels like they want to remove a tenant. So typically a landlord's not filing, there's not some magic back rent where a landlord decides to file at that point. Oftentimes we really see folks fall behind on rent and then stay housed, and then that's sort of held over them for a long time until something else happens, which I think a lot of our work points to kids, like the presence of kids, someone becoming pregnant, um, something else changing about the household, composition, where then it's like, okay, now we're going to file for eviction. We're going to say it's non-payment of rent, but that's sort of a non-payment. There's sort of this chronic. Folks are behind on rent and have really struggled to keep up on rent over time. Um, and how exactly that shapes the point of which when the eviction filing happens and someone's actually threatened with being displaced. I think it's just complicated. It's more complicated than, you fall behind on rent once and then you get filed against right away. But in terms of the other things like lease violations, um, I think it's just a huge mix of stuff. Uh, and I think, as Will mentioned, because tenants don't have legal representation, the burden of proof is extremely low. Um, so often there might be an allegation of property damage or something like that. And no, the often don't have to really present evidence of that happening. It gets really messy how this happens in court when there's many filings coming through and tenants don't have representation.
Great. And our next question here is, do any states or municipalities require more detailed demographic or household data through the court process? This question is kind of curious about strategies you described for identifying outcomes from a more opaque data set.
Yeah, as far as I know, and I'm also not super familiar with exactly what's on the court filings in, here in Minneapolis and St. Paul. As far as I know, almost nowhere has more detailed data beyond names and addresses. Um, so I think, yeah, and a lot of places have very low quality address data. So a lot of parts of the country, we basically can't use the data at all for the process, what the research I just described, because the quality of data, even names and addresses collected is so low, which really it is opaque. It makes it a black box of trying to figure out who's coming through housing court and what's happening to them afterwards. Um, because we don't sort of have this good, high quality data infrastructure to keep track of those things. So I think something we've pushed for at the lab for a long time is, more investment in data systems and, from the federal government, taking a more active approach in investing in these systems at the state and local level. Uh, it seems like something we should keep track of in a more systematic way. And, ideally we wouldn't have to rely on this sort of ad hoc process for trying to, piece together these data sets over time, often in this probabilistic way where we're having to, match people. Yeah, so it feels like a work in progress.
And I'll just add, locally, it's very bare bones. I believe it is just name and address at our housing court. And we've used geography as a proxy indicator to get closer to the demographic characteristics of those with eviction filings. And um, that's led us to very specific pockets of Minneapolis and the northern suburbs who have very highly disproportionately higher rates of eviction filings. And those are predominantly communities of color, and namely Black African American communities, North Minneapolis, Brooklyn Center, Brooklyn Park. So that's been one approach we've taken to sort of get around that, but it's very limited.
Great. Well, we'll give another moment here for questions, but we're coming up on the hour. So get your questions in quickly if you have them. Otherwise, we'll close here in just a minute. If we don't have any more questions, I'll just say thank you, Dr. Graetz, for this presentation. Thank you, Will, for joining our Q&A. Thank you to all of our attendees for joining us. Please look forward to an email from hup@umn.edu with a survey and a link to the recorded webinar.
Thanks, everyone. Thanks, Dr. Graetz. Thanks, Will. Thanks, attendees.
Yeah.